Assalamu alaikum. Hello, dear friends. This is one of a series of videos about hospital policies and procedures, which are written instructions on how staff members do different processes. Policies are general rules that govern our performance, and procedures are sequential steps on how we do it, and the responsible person for each step. We can update these rules when we have new standards to follow. In this video, we will talk about discharge against medical advice policy. For more videos, please visit my Facebook page, Healthcare Quality, and my YouTube channel, Dr. Hassan Kamel. If you like it, please support me with likes and follow. This policy is applied to all hospital employees, medical, nursing, social worker, admission and discharge office, and to all other hospital employees involved in discharging patients. The purposes of this policy are: 1. To establish and identify guidelines on how to handle discharge against medical advice cases and against medical advice cases. 2. To define discharge of patients against medical advice. 3. To define against medical advice. Definitions. 1. DAMA is the acronym word for Discharge against medical advice, which means that a patient leaves the hospital on his or her own wish and responsibility without proper discharge order from the attending practitioner. Patients shall be discharged only on a written order of the treating doctor. 2. AMA is the against medical advice, which means that patient refusing the treatment or procedure that the attending physician offers and suggests. Policy statement. 1. It is the policy of our hospital that those patients or their relatives who insist on discharge against medical advice or refusal of treatment or procedure shall not be denied treatment as outpatient and inpatient upon their request. 2. The policy states that the treating team should make an effort to convince the patient and relatives to stay, explain about the treatment and procedure and patient's medical condition, consequences of going in relation to his health and wellness, and that the patient is living at his own risk against medical advice. If they still want to go DAMA or AMA in spite of the justification given, all patients or their relatives requesting for DAMA or AMA should sign the appropriate form or giving thumb mark before leaving the hospital. The DAMA or AMA form will be countersigned by the relatives, and the treating doctor can sign as a witness. The social worker should be informed to talk with the patient and the member of the family and witness of the DAMA and AMA form. 3. Incidents of DAMA or AMA cases should be documented in the patient's medical record by the treating doctor and nurse. 4. Patient has right to use ambulance if he has officially acceptance from another facility, even if he or she signs DAMA. 5. Patients' relatives have no right to ask for an immediate medical report, but they can take within 1 week. 6. All completed DAMA forms duty should be placed
informs
in the
treating
patient's
doctor
medical records
or the on-call doctor
regarding patient's wish to go DAMA or AMA. The doctor and social worker explains to the patient the need to stay or importance of treatment or procedure and the consequences of going in relation to his health and wellness. 3. The patient and or his or her relative or authorized representatives sign the form on the time and date the patient will go. The treating doctor or on-call doctor should also sign on the space provided. 4. The signed DAMA or AMA form is attached to the patient's medical record. 5. The primary healthcare facility doctor, primary physician, should be informed, if any. 6. The nurse on duty informs nursing supervisor on duty, admission and discharge office, as well as bed management office of discharge. 7. If the patient signed DAMA, the treating doctor has to give prescription, medical report within 1 week, and if there is acceptance for another facility, to provide ambulance for transfer. Responsibility. Doctors, nurses, and social workers, and all hospital employees shall be responsible to review and monitor this policy and procedures. Here is an example of the DAMA and AMA form in Arabic and English. Approval of each policy is usually done by the preparing person, recommended by the department head, reviewed by the nursing supervisor, and approved by the quality director, medical director, and hospital director. Thank you.